Good morning. This is Michelle Smith, State Coordinator for Action for Healthy Kids. Welcome to School Health Advisory Council. What does the law say? I am very excited to be doing this webinar today to kind of look back at where we came from as far as history of the SHAC and how it came about and all of the different iterations that have come through. So welcome, and I'm going to introduce the person who's going to do the majority of the talking. He is a member of the Houston ISD School Health Advisory Council and then serves on 8 other councils as a community member. So he has definitely dedicated a lot of time to working with SHACs and did a wonderful job helping facilitate this presentation. So Eric, I am going to turn this over to you. Oh, I guess I better do my logistics first.
Okay.
You're using your phone or your computer, obviously. If you have any problems, please put something in the question box. You will be muted. You can submit questions during the presentation, and we will have some time at the end, hopefully, to answer those questions. This webinar will be recorded, so it will be on YouTube, and we'll send a link to everyone who registered, as well as the slides. And then It's Time Texas, who is our partner on the School Health Advisory Council webinars. You'll see their excuse me, their website or our website with them. It's timetexas.org/SHAC. You'll find a lot of good resources there. And they will send out CEU certificates for the webinar by the end of the month. So if you're interested in getting one of those, they will be sending those out. So now I'm going to turn this over to Eric.
Okay, great. Yeah, we will start first with the first slide, the SHAC overview. And basically, the current state law makes it clear that all school districts must have a school health advisory council, also known as a SHAC, at the district level. This legislative mandate gives the SHAC the authority to review and make recommendations concerning local school health curricula and policies. However, there are still some school districts that do not have a SHAC. So how does a SHAC get started? The school board has the responsibility to appoint the SHAC members. Often they will direct the superintendent to make recommendations and to initiate the process. Established SHACs have also devised many ways to recruit members, distributing flyers at district events, posting on district websites, presentations at parent-teacher organizations, and requesting recommendations from campus principals. Each year, the SHAC must submit a roster of current members for the board to approve their appointments. Okay, on to the second slide. So in this presentation, we will review the legislative actions that created Section 28.004 from the Texas Education Code. This section contains information specific to SHAC laws for the state. We will also review amendments to that section over the years to see how requirements for SHAC membership and their activities have changed, and how SHAC's responsibilities have expanded over time. Finally, we will also look at some of the other laws related to school health that directly impact SHACs, although there are many other regulations pertaining to SHACs and school health that we do not have time to mention. It is helpful for SHAC members to review these legislative actions. Understanding the development of current laws concerning SHACs can help members be more efficient in crafting recommendations when they have a good understanding of state requirements for school health. It may also be useful to include information on these regulations in the SHAC's annual report to ensure board members and district administrators are also aware of their requirements. SHAC recommendations can be more effective if the board understands how the SHAC can support district efforts in implementing school health laws. To next slide. In 1995, the Texas legislature created health education advisory councils to assist local boards of trustees in selecting curricula for the human sexuality instruction. The selection of such curricula carries considerable political risk for board members. So the idea was to engage parents and other community members in the process so there would be some political legitimacy for the board's decision. This legislation also established the role of local community values as the foundational characteristic of such advisory councils. Next slide. Yeah. I think we're a little ahead. Yeah, go back.
There we go.
Right there. Yeah, SB 1 established the primary duties of these new advisory councils, focusing on the scope of the recommendations they should provide for human sexuality instruction and health education in general. The law also sets up the structure of the advisory council, establishing membership as consisting of people with diverse views from the community, suggesting different categories of persons who can serve. It also outlines the most crucial membership condition for these councils, with children enrolled in the district. Okay, next slide. So in 2001, it expanded the council's duties. There were no amendments the next two sessions, 1997 and 1999, but in 2001, the Texas legislature passed Senate Bill 19, which expanded the council's duties beyond human sexuality instruction to include elements of what we now know as coordinated school health, or CSH. And these include health education, physical education, nutritional services, parental involvement, and tobacco prevention. Next slide. So part of the SB 19 was the legislature's embracing of coordinated school health. This bill required districts to include daily physical activity for children in grades K through 6. This bill also allowed recess to be considered part of the physical activity time. It further emphasized the SHAC's roles in representing community values, including that health curriculum could not be revised without recommendations from the SHAC. This did not mean that SHACs had to follow the SHAC's recommendation. The district didn't have to follow the SHAC's recommendation, but it had to consider those recommendations. And so it had to the SHACs are required to recommend the number of hours of instruction to be provided in health education and the health education curriculum that is appropriate for each grade levels as part of the coordinated school health. So SB 19 also specified that only members who are not employed by the district can be classified as parent members. I guess up until then, there were a lot of teachers who were calling themselves parent members. So it went further to specify that they couldn't be employees. It also added representatives of nonprofit health organizations as potential community members for the council. Next slide. So in 2003, Senate Bill 1357 changed the name of the council to its current School Health Advisory Council, or SHAC. This change reflected the trend toward expanding council duties to include issues beyond health education and human sexuality instruction. As part of that expansion, this legislation added 4 other components of school health to the scope of health topics that the SHAC could address. So school health services, counseling and guidance services, safe and healthy school environment, and school employee wellness. It also required the Commissioner of Education to adopt criteria for evaluating school health programs. Next slide. SB 1357 also initiated the process of addressing transparency on a variety of school health issues other than school health, human sexuality instruction. Such policies are now publicly available on board policy online websites for each district, although most parents and community members are not aware of these websites or how to access specific policies. Now that led to fine-tuning of the legislation in 2005. So following SB 1357 in 2003, legislators realized that parents and many campus staff were not really aware of these health policies. So in 2005, legislators passed a requirement that districts make their policies more accessible to the public and district employees by publishing them in student handbooks and on district websites. This legislation, SB 42, also expanded the mandate for physical activity, adding 2 semesters for grades 6 through 8 to include those for middle and junior high school, specifically to ensure that students were engaging in activity and specifically reporting on the number of SHAC meetings from the preceding year. That preceding year wasn't specified previously. Next slide. In 2007, SB 530 required SHACs to make policy recommendations to the local board of trustees concerning recess. This legislation also introduced the requirement for an annual fitness assessment of students in grades 3 through 12. While the mandates for physical activity are not the direct responsibility for the SHAC, it is within their purview to oversee the implementation and work with the district to ensure these policies are put into place. Next slide. In 2009, the legislation again focused on SHAC structure and activities, requiring that SHACs meet at least 4 times per year and that one of the parent members serve as chair or co-chair of the council. It also required that SHACs submit an annual written report to the local board of trustees that outlines the SHAC activities for the previous year. Next slide. Also in 2009, SB 892 gave SHACs the ability to recommend coordinated school health indicators for district campuses to include in their improvement plans. Legislation in 2011 focused on violence and mental health in several related bills. SHACs are increasingly dealing with a broader range of school health issues passed by these legislative actions. So SB 736 adds a representative from a local domestic violence program to the list of possible members for the local SHAC as part of that series of bills. Next slide. So in 2013, the legislature passed House Bill 1018 to ensure that physical activity in public schools was a priority for district SHACs. This law requires every SHAC to have a standing subcommittee on physical activity. And part of this subcommittee's activities include establishing joint use agreements between the district and community organizations, such as opening campus facilities for community use outside of school hours. The subcommittee may also contribute a summary of its activities for the annual SHAC report to the local board. In 2013, SB 460 included the requirement that teachers in public schools be trained in mental health intervention, and it also integrated mental health into coordinated school health efforts. This legislation also expanded the responsibilities of SHACs to recommend policies, procedures, and strategies for school health. Previously, the law mentioned only SHACs in recommending health curricula. And in the last session in 2015, there were no SHAC-specific legislative actions. So to summarize the legislation over the last 20 plus years, you've got to realize that SHACs began with the single goal of assisting districts in the selection of human sexuality curricula. But over these past 20 years, the Texas legislature has expanded the scope of SHAC responsibilities to encompass other components of the coordinated school health model. SHACs also play an increasing role in helping districts implement school health policies and to notify the public through their annual reports and other documentation, such as meeting minutes. As SHACs garner more experience and develop greater expertise in school health matters, boards and district administrators increasingly include SHACs in their policy considerations and activities. So looking at the current legislative session, there are many bills circulating in the current session related to SHACs and school health. These cover everything from human sexuality instruction, there's always bills on that, childhood immunizations, cyberbullying, and e-cigarettes. The bills we have listed here are some of the proposals that could specifically impact SHAC structure and activities. For example, SB 355 specifies the type of information recess recommendation should contain. SB 1303 expands SHAC duties to make recommendations about food and beverage advertising on campuses. And SB 1678 would add nutritional specialists to the list of possible members for the local SHAC. And at the bottom there is a link where you can go to the Department of State Health Services, and they have regular updates on some of these legislative actions, a list of the bills that you can click on and go read the text, as well as looking at how they've progressed through the process. So sometimes it's not immediately apparent how a bill might affect SHACs. HB 11 is a lengthy bill on school mental health that amends many sections in the Texas Education Code, including several parts of SHAC section 28.004. HB 4138 is one of several bills that addresses human sexuality instruction, but also includes language to increase the transparency of SHACs by requiring the timely posting of SHAC meeting minutes on the district's website. Finally, there is SB 1310, which seeks to eliminate the SHAC requirement that seems to stem from this legislator's desire to eliminate all regulations. However, since legislators have proposed a variety of bills to further expand SHAC activities, personally, I don't see how this bill gets much support.
Agree.
So as the legislature has increased the burden of responsibilities, SHACs have adapted by expanding membership and creating subcommittees to carry out policy reviews and recommendations. These subcommittees draw from an increasingly diverse set of school health experts composed of district employees, parents, and community members. So, as the legislature gives us more unfunded mandates, we have to figure out in SHACs how to best deal with these. And some SHACs have more meetings, some SHACs I'm on meet 8 times a year, just to try and deal with all of the issues we have to address now. So the expansion of SHAC responsibilities through legislative action over the years demonstrates the importance of SHACs. Yet many SHACs still experience difficulties recruiting members, especially parents. Emphasizing members' roles in formulating recommendations for policy change and implementation might entice more parents to join. Issue that requires increased SHAC participation concerns new federal guidelines for creating new local wellness policies. Federal guidelines for the Healthy and Hunger-Free Kids Act of 2010 states that parents and community members need to be part of the policy drafting process. Moreover, the new wellness policy has to have an implementation plan to measure how the policy goals are enacted in the district. Finally, districts have to produce reports on policy implementation and post the results for the public. SHACs are thus an ideal forum to help the district carry out these activities related to the new wellness policies.
That's, that's one of the things that I think most of the SHACs that I've worked with in the last year or so are focused on is the wellness policies. If the SHAC doesn't do this, then the district has to create a separate committee, which would mirror the same individuals or same groups as the SHAC to actually work on this policy. So it's running through the Department of Agriculture, and the child nutritionist at the district has to be an integral part of this policy development. And that's the monitoring system for these policies. But if your district is not using the SHAC and updating their wellness policies, then they have to come up with a different committee to do this.
So the good thing about SHAC legislation is that the requirement for districts to have a SHAC, reviewing previous legislation and following current deliberations in the legislature provides a good understanding of the SHAC structure and its responsibilities concerning school health. And these are some of the ways that SHACs can use this information on legislation to further their activities and to perhaps produce some recommendations that are useful for the district.
Okay, so that's an overview of where we've been and how we've got where we are. A lot of these laws were introduced and turned into policy based on issues that the SHACs were facing. For instance, the issue of who was running the SHACs. I've worked with the legislature, and Action for Healthy Kids has worked on these policies. And we would have schools come to us and say, we have a SHAC, but the school nurse is in charge, and the superintendent will not let us look at the things that we are interested in looking at, and she's stuck. She can't do anything about it because she was employed by the district. So we went to Senator Jane Nelson and said, we would like to see how we can fix this. What if we make a parent as a co-chair or chair of the SHAC mandatory? And she has been a real advocate for school advisory councils and helped us with that bill. Same thing when it came to the parents. We were having a lot of schools were having challenges because all of the parents that were being appointed were employed by the district. And again, they were not as likely to want to deal with some of the hard topics. So making the law that qualified which type of parents, at least 50% would not be employed by the district, didn't mean that you couldn't have parents that work for the district, but that we definitely wanted to make sure that at least half of the Schools Advisory Council was composed of parents who didn't work for the district. The campus improvement plan, a lot of the things that SHACs would act on, like recess, weren't actually getting implemented. So it was suggested that we have, as part of each campus's improvement plan, how they're implementing coordinated school health and how they're ensuring that students are getting the physical activity requirements. So the legislature has been very helpful in continuing to look at the benefits that schools advisory councils provide and expanding the scope of what they are allowed to look at. As Eric, I've been involved with school advisory councils for many years, and the ones that are really good and take advantage of these laws and ensure that the things that they are supposed to be working on are addressed to the district have been really successful. So if you have questions, I have a few questions here. Are charter schools under the law as well? It's all public schools, isn't that correct, Eric?
Correct. And depending on the district, so for example, Houston ISD has a lot of charter schools, and we're still trying to figure out, because if they're part of Houston ISD, they the policies, but yet they have a different kind of oversight. So we're not exactly sure how that works. But no, if you're not a public school part of a district, then no, you shouldn't have a SHAC. You could.
I know it's difficult, but yeah, and I guess you could go to your school administration and make the recommendation, but it's kind of like the wellness policies. They're not mandated for charter schools, and I've had parents come to us and say, what do we do if we want to make, you know, changes or improvements in our school meal program through the wellness policies, and they're not required. So it's a little bit more challenging. So we're really lucky that we have this process that we can use with public schools to improve the wellness environment. Okay, I have someone said, I recently learned of a SHAC who, upon reviewing their wellness policy, removed the language that addressed obesity prevention. They feel that overall health should be addressed, and therefore that was their rationale. What thoughts do we have on that, Eric?
I think the idea behind that is to not focus on obesity, to try and destigmatize it. I mean, these policies, from the wellness policy, it comes down from the U.S. Department of Agriculture. So it's part of the National School Lunch Program. So it is primarily focused on obesity, and that's why it emphasizes nutrition and physical activity. I agree that it should be a broader sense of wellness, that coordinated school health should be integrated. Yeah, I'm not sure. And that's why every district has its own wellness policy, because if that is what they want to do, then that should be okay. I don't know that it means that it's not going to be addressed, because a lot of the goals that are part of the wellness policy are still there, and they deal with nutrition and physical activity, so they do address obesity. Eliminating the language, I don't know that that would have any effect directly.
I kind of agree. I think we continue to move away from using the word or the term obesity and look at being healthy. And I don't think that it has to be part of a wellness policy. The wellness policy is more directed at implementing healthy activities around nutrition and physical activity. So leaving it out, if it's more effective, is certainly something that you can do. As the SHAC coordinator for a small rural district, 900 students, PK through 12, it's difficult to get parent involvement and keep up with all these government mandates. We have a 68% socially and economically disadvantaged student body. How do you propose small rural districts keep up with all the new mandates? That's a really good question. I can tell you that all this information is listed on the It's Time Texas/SHAC webpage, as well as the resources and the timeline for all the different bills. We do at least 4 webinars a year around School Health Advisory Council topics. I'm open for questions and offering information, and Eric has offered his contact information as well, so that if you have questions, but there's not a formal way of keeping up with School Health Advisory Council mandates that I'm aware of. Normally that information would go down through your superintendent's office once if something new law is passed, but how they're distributing it is a district level decision. Eric, you got any thoughts on that?
Yeah, as far as districts, all districts have problems maintaining parent involvement and getting to that majority requirement. So small districts are not alone in that problem. And as far as getting information on policies, that's what I've seen as a problem, is if administrators and whoever gets these change in policy notifications, if they're not aware of the SHAC and what it does, then sometimes these changes get lost and don't go to the right people. And I know some districts that have had difficulty in starting their wellness policy changes because they didn't, whoever was getting that information didn't pass it along to them. So yeah, I think a big part is just getting everybody to recognize that there is a SHAC, that it has this role, that it can be very helpful, and just try and get parents involved. And if you are communicating effectively with your board and your administration to make real changes in the district, that's appealing to parents. You know, usually they get a runaround, or they might not know who to talk to for some complex issues. The SHAC is a perfect place for them to be heard and for them to communicate with the district.
You know, your school nutritionist also will be getting information on things, especially as they relate to the wellness policies from the Department of Agriculture. So making sure that your school nutritionist, your food service people are part of your SHAC is going to be really helpful in making sure that you know what's coming down from the federal level as well. With our current situation with the child nutrition reauthorization, not sure what direction that could go, but that will be coming down through child nutrition services. So making sure they're part of your SHAC, making sure that your PE people are involved. TAFERD, which is the Physical Educators State Organization, keeps all their members engaged and involved on different mandates. So making sure you have those people involved in your SHAC is important. Some school districts do not have SHAC meetings posted on their district websites. How can they be held accountable with this, or who can this be reported to? Sadly, there is no oversight group for school health advisory councils. TEA used to have a stronger role in that, but they disbanded their health and safety committee and have one person really over there that even looks at health and safety right now, and they're primarily involved in fitness grants. So your best recourse is board members because they have the mandate for appointing school health advisory councils and making sure that they follow the guidelines. I would suggest we have a board member who sits on our SHAC, and so they are always aware of what we're doing, and the school administration is very aware that they're involved with us, so they follow the rules pretty closely. So if you can work with your school board members, I think that would make a good friend there. That would be helpful. Eric? Okay.
Yeah, that's a common problem. Part of it stems from many districts just having one person in charge of the website, and they're inundated with a ton of things to post. So SHAC meeting dates and minutes probably is a low priority. And yeah, I find that a problem, especially as I try and attend a lot of different SHACs and go to new ones, is that sometimes the meeting dates they have are 2 or 3 years old, if they have any meeting dates, but usually they will have at least a contact person on there, and that's someone you should communicate with. I think this this bill that's currently there that would require SHACs to post their minutes in a timely manner is a good idea. How that would be enforced remains to be seen, but again, look to the legislation for some good ideas and some not so good ideas, but you can pick out kind of what's on legislators' minds and perhaps what they have heard from their constituents as to what they want to be addressed, and you can try and implement those even if the legislation doesn't pass.
This comment kind of relates to this. PTAs have a role to educate parents about the SHAC process too. If a district does not have a functioning SHAC that includes parents or PTAs should be advocating for it. Each Texas PTA is required to have a healthy lifestyles chair that serves on SHAC and PTA. So if you have a PTA in your school or your school district, getting with them and getting their involvement can certainly help you get people on your SHAC and hopefully get more participation with your SHACs. Thanks, Lisa. Any more questions for Eric and myself? We left lots of time for you guys because there are so many laws, and I know we went through it pretty quickly. So the good news is we'll send you a copy of this, and you can peruse it. And then if you have questions about what you read relating to any of the different laws and what they mean or how you can best approach them, feel free to reach out to Eric or to me, and we'll be happy to explain as much as we can. And keep an eye on what's going on at the legislature this session, because there may be some new policies that you'll be getting to implement. I want to thank our Action for Healthy Kids SHAC leadership team. All of these organizations participate at a state level with us on our School Health Advisory Council work. We feel it's extremely important to support School Health Advisory Councils as much as possible. Right now, there's no oversight, as I mentioned, by state agencies for SHACs, but we hope at some point in time they will regain some oversight there. Oops, let's see. I think I have another question here. It seems there's a lot of legislation coming down the line without ways to monitor and enforce. How are we supposed to get involvement and support from administration if there's no follow-up from the state? It's a good point, and we need to certainly keep working on that. So I'm certainly open for suggestions. We'll continue to work with the legislature if we can find ways. Right now, the economic situation doesn't allow for a lot of policy work that involves any kind of funding. So finding ways to hold SHACs or hold districts accountable for SHACs becomes an unfunded mandate. And there's always a fear that if we push too hard for accountability right now, that you end up getting a law passed that says we're going to do away with SHACs completely. So we're kind of walking a fine line right now, and we're not really pushing for accountability this session. That's not to say we can't come back and visit it. Or if we get, we do have a education commissioner now who's very interested in health and fitness. And so if he stays and we continue to work with him, there's always an opportunity that they may put something in place that would help us with the district's accountability. Do you have any ideas, Eric, on what they can do as schools or school districts?
Well, I've heard, and don't know how true any of this is, but I've heard that TDA, the Texas Department of Agriculture, is going to be a little more stringent in how they evaluate these new wellness policies, and looking closely at how they were put together, how they've been implemented, how they're going to be reported to the public, and that money could be tied to whether you're doing it properly or not. So it'll be interesting to see moving forward. Those wellness policies are supposed to be in place this summer. I can't remember if it's the end of June I think it's the end of June, beginning of July. So it'll be interesting to see if that is true and they start, maybe saying, well, where is your parental participation in drafting this bill, in drafting this policy? How are you measuring it? How are you reporting out to it?
Okay. Anything else? I'm not seeing any additional questions, so we appreciate you attending. Thank you, Eric, so much for helping share the SHAC laws with our state. And we'll be back in the fall with some additional SWELF Advisory Council webinars. Reach out to me if you have a topic you feel we should be covering. And have a great summer. Thanks.